I'm talking into the mic. I don't know whether you have it turned up or not, and I'm using my best basso profundo voice to test out the microphone. How does this seem to be working? Thumbs up, thumbs down, neutral? Shall I keep talking? Okay. Are we finished?
All right. Good afternoon and welcome to the City Club of Eugene's November 7th, 2025 program, The Gaps in Employer-Provided Behavioral Health Care. My name is Thomas Hura. I serve as president of City Club, and I'm pleased to welcome you to another of the many forums we have held since 1990 in the name of our mission to build community vision through open inquiry. City Club is lucky to be a trusted, open, and independent voice for Eugene area community members to be heard. And as a lifelong Eugenian, I do believe the community is lucky to have the City Club and to hear from our program guests and questions from the audience, whether here in the beautiful Wow Hall, online, or over the radio. We believe these kinds of gatherings around critical community topics strengthen our understanding of one another and ultimately our ability to support the community building work in so many sectors of Eugene. In today's fractured information landscape, we want to be a space where you can participate in unearthing, disseminating, and sharing relevant information in conversation together. We would love for you to browse our past programs at cityclubofeugene.org or our YouTube or Facebook. Please consider becoming a member if you'd like to support our rigorous volunteer work as Oregon's only city club that meets weekly. There are many ways to partner with us, and I'd like to thank our Diamond community sponsors. The University of Oregon has helped Oregonians question critically, think logically, reason effectively, communicate clearly, act creatively, and live ethically since 1876. Get more information at uoregon.edu. Lane Community College transforms lives through learning. LCC provides comprehensive, accessible, high-quality educational opportunities that promote student success. For more information, visit lanecc.edu. Thank you to the City of Eugene and to Lane County for their generous support as well. A quick reminder, please silence all cell phones in the hall. Our program today was coordinated by our board member and rising star, Alyssa Gilbert. She's asked me to introduce our program and speakers today. Oregon employers face a growing challenge, providing meaningful health benefits amid rising costs and limited budgets. In 2023, average employer family plan premiums reached nearly $24,000, with employees covering a significant portion. Meanwhile, Oregon struggles with a shortage of 3,700 behavioral health treatment beds and unmet demand for substance use services. With less than half of providers equipped to treat co-occurring disorders, many employees face fragmented care. This session explores how these pressures converge: rising costs, insurance design constraints, and substantial gaps in behavioral health access. We have three astute panelists today. Stephanie Evans-Wondra, LPC. Stephanie holds a master's degree in clinical mental health counseling. She enjoys working with people experiencing symptoms of anxiety, depression, grief, and trauma, while understanding that people are doing their best with the tools they currently possess. Stephanie is adept at working with couples and helps couples resolve issues and move forward in their relationships. She has experience facilitating training workshops and has previously worked with the United States Army to provide training to military dependents through their Army Family Team Building program. Pete Kearns was named President and Chief Executive Officer of Serenity Lane in 2019. Serenity Lane is a private, nonprofit treatment center for alcohol and substance abuse. Pete brings 36 years of service with the Eugene Police Department and experience as the Chief of Staff for St. Vincent de Paul Society of Lane County. He is also the son of Serenity Lane's co-founder, Dr. Thomas Kearns. As Serenity Lane's leader, Pete brings a deep connection to and understanding of the community that Serenity Lane serves. Part of Pete's vision includes updating Serenity Lane's long-term strategic plan with a focus on providing more access to services. And finally, Rob Sheely is a seasoned health insurance industry leader with over 25 years of experience driving innovation in sales, account management, and workforce health strategy. For the past 12 and a half years at Kaiser Permanente, Rob has led large group account management teams to deliver solutions that align population health insights with clients' business performance goals. A recognized change agent, he has championed initiatives such as food as medicine programs and workforce reliance strategies. His strategic vision and ability to uncover unconsidered needs have positioned him as a trusted advisor to employers navigating complex health challenges. A graduate of the University of Wisconsin-Madison, Rob is passionate about advancing health innovation through employee engagement. Our first panelist today will be Pete Kearns.
Well, thank you for hosting the three of us to talk about this important subject. I'm just going to cover 3 items while I'm up here. I'll give you a little bit of an overview of the state of behavioral health treatment need in the United States and Oregon, roughly what the spend is in the United States and Oregon on behavioral health by employer-sponsored healthcare plans, and then a little bit about what the business model looks like in healthcare so you can understand it. In the United States today, in the last 10 years, the prevalence of mental health has grown significantly. And just as an example of one condition, depression among adolescents and adults has grown 60% in the last 10 years. Substance use disorder, about 10 years ago, was thought to affect about 8.2% of the United States population. Today, it's over 17% of the U.S. population. The behavioral health service needs that are projected to be required of our services in the 2026 is about 25% of the U.S. population, or 84 million people. Oregon has seen the highest increase in diagnosable behavioral health conditions in the last 10 years. It's been somewhere between 50 and 100% increase. Overdose deaths per 100,000 Oregonians was 12.4 per 100,000 10 years ago. In 2022, in the middle of the pandemic, it was 31.1, and it's steadily come down since then for a variety of reasons. Employer-sponsored health insurance in the United States has gone up about 4.6% a year in cost over the last 10 years. Analysts predict that it's going to continue to go up about 4 to 7% per year in cost. Employer sponsored plan cost increases between 2015 and 23 has been about 33%. So it's going up steadily, and it's a significant part of the expenses of any small or large business. And the way that we've adapted to that is to put more of the burden on the employee that signs on to that plan. And that comes in the form of growing deductible or growing premiums, or an increase, or adding another insurance plan to their family's coverage. Behavioral health claims are believed to consume about 10% of any of the claims in an employer-sponsored account. Now, the healthcare model, the business model, is different than some. It's a fee-for-service. We provide service to individuals, so a larger portion of our expenses is in personnel costs, unlike manufacturing where it would be lower. 25% of our costs are in the cost of providing 3 meals a day to inpatients, for instance. So the cost of the food, the cost of the equipment to run the kitchen, the business equipment costs, IT, facilities, infrastructure, that sort of thing. So that's about 25% of our costs. 75% is with personnel, and these are the people, the professionals in our workforce that are in the highest demand in the United States, and the same is true in Oregon. So physicians, registered nurses, physician's assistants, psychologists, psychiatry, mental health therapists, counselors who provide only substance use disorder treatment, and then all the administrative staff. So that's the cost side of running a healthcare business. The revenue side comes from insurance companies. So we, at Serenity Lane, we're a microcosm of what you see in every healthcare business in the United States. We have contracts with commercial healthcare insurance payers, like Pacific Source or Kaiser or Blue Cross Blue Shields. We have contracts with about 15 or 20 different insurance companies. And when a patient comes to us, we discern a diagnosis for their condition and then decide on a treatment plan. And we feed that into the electronic health record system. We have the patient chart. And on the other side of that is an entire workforce whose responsibility is to pull that entry out of the chart, actually physically call the insurance company, describe the diagnosis and the treatment, and get approval that it'll be paid for. The insurance company agrees that, yeah, that diagnosis calls for that treatment, and we commit to pay for it. And then we provide the service and eventually bill the insurance company, and if there's a deductible, also the client. We do that hundreds of times a day at Serenity Lane, probably thousands of times a day at Peace Health, and that's what keeps the machine moving. Now, what every one of us in this business also deal with is what every mid and large business experiences, and that's every 12 months, once a year, we go out on the market and we look for a healthcare plan for our employees. And we'll find the one that provides the kind of coverage that our employees through experience require or need or would benefit from, and that we can get at the most reasonable cost. And every year we do that, and every year that expense goes up naturally, just like all our other expenses do. But in healthcare, at the same time, we're also negotiating with those same insurance companies for the reimbursement that they're going to pay us. And without fail every year, our cost to pay for our employees' healthcare benefits go up at a much higher rate than our reimbursement rates go up each year. And it's really this disparity, the rising costs that include the employee benefits and the very rigid costs of what we're reimbursed for the care, that's really going to create the crisis in the future, a crisis that we're beginning to see now due to some of the changes that have happened in Congress this last year, where rural clinics and rural hospitals are starting to close because they haven't found a way to deal with that disparity both in revenue and expenses. So that's the overview I wanted to provide before we bring on our next speaker, which is Stephanie from Cascade.
Good afternoon. Thank you all very much for inviting me to this very important topic about which I am incredibly passionate. I'm a counselor for Cascade Behavioral Health, and we are a part of Cascade Health Solutions. We're located up over by Costco. I feel like I get to be a bit of a hero today in coming in and talking about the employee assistance program that we provide to many businesses within the area, over 75. Before I do that, I'm going to tell you a bit of a story about how this can work, all right? I've been with Cascade for 7 years, and 4 years ago, we got a call from an employer, and they said, one of our employees is not behaving the way that they typically would. And we have one of our other employees driving them over to you. They're part of our EAP. When that person came to my office, and I was the person who dealt with this, it was very clear to me that this person was in active psychosis. The words that they were saying were not making sense, and they were doing things that I assume they probably would not ever do otherwise. And so we called a loved one of this person, and they came, and they got this person, and they took them to the ER. And that person was admitted into hospital care. and we got word not long afterward that the person had gotten medication, was doing much better. That person never came back to see me, and that's fine, but that's how employee assistance programs can work. We got somebody in active psychosis into the emergency room that day, and they received help. So, you might be wondering what EAP does. We have lots of different things that we do. Part of that is that we contract with employers so that people within that company and everyone within their household, related or not, can get a number of counseling sessions provided by the employer. That's pretty unusual these days. You can call our office, and if you're part of our EAP program, we typically tend to be able to get you in within a week. If you call around to other mental health professionals these days, you're looking at a wait time typically. They can put you on a list and they will call you back, but often you'll struggle to get in. So we really pride ourselves on being able to be available like this. Beyond that part of our program, we also offer things like management referrals. So if an employee is struggling and you've had conversations with them and you're not seeing the kinds of improvement that you would prefer, you can send them to us and we will talk with them about what's happening. Oftentimes, there's far more happening than that's happening at work, right? And so we can talk with people about what's happening in their life, how that's affecting their work, what kinds of things, what kinds of outcomes they want, and then how to get there. We also talk with managers often. We have a manager consult, and so people who contract with our EAP can call us and ask, I've got this sticky situation. What can I do here? And we provide that service. That is incorporated within the cost of the EAP service. We also provide critical incident debriefings, and we do this with many companies across the area. We feel very, very honored to be called in on these moments where something critical, typically something pretty horrific has happened within that company. And we will go in and speak with the people who are affected and provide the kind of very short-term, very brief counseling that needs to happen to at least help them get to a place where they can get other counseling if that's the need. Beyond that, we do our leadership series, and we do this 3 different times throughout the year, and contracted EAP program, or contracted EAPs contact us and then send us people so that they can take part in our leadership series. It's a 7-course series. A lot of it is based in those kinds of soft skills that people are needing within the workplace. And then beyond that, we also do a wellness program once a quarter that we provide, and it's an hour long. Our next one coming up is Detaching with Love. And then beyond that, if you're contracted with our EAP, we provide what's typically 2 hours of tailored courses for your business. We have a series of different courses that we could pull from, certainly. But if you'd like something that's even more tailored, we certainly could work with you to make that happen. That would come at an extra cost. So, yeah, that's the EAP part. EAP used to be that you would come in and it was very short, very focused, very brief counseling, and then you would be done. And today, people are using EAP more along the lines of a foot in the door, and then maybe a referral after that, depending. But it's often a way to get in and get established with a counselor. We feel very fortunate at Cascade in that we get to partner with a few different universities around the area, and we have some magnificent interns working with us. If people come in and they see an intern during their EAP, and they decide that they want to then continue to see that person after their EAP, the charge is $30 to see an intern. And for those of you who have dealt with any kind of counseling, you know that that's a pretty good price. And then beyond that, we also have registered, what are termed registered associates. These are people who have their master's degree, and they are working towards their licensure. And if you come in and wind up seeing somebody there and then would like to still work with them, if they don't accept your insurance, then we charge $60 an hour for that. So still a pretty reasonable price for mental health care in our society these days. And like I said, we really pride ourselves on the fact that we can get people in fairly quickly. So, thank you. Robert is our next speaker.
Hey, everybody. Yes, I am a Wisconsin Badger in the Ducks house here, so thank you for having me. I still remember sitting in the Wisconsin Union when I found out the Oregon Ducks were joining the Big Ten, and I was like, whoa, this is going to be great. So this is my first opportunity to do a speech in front of people that are part of the Big Ten, so just really appreciate it. One thing that's not in my bio is I majored in psychology, so this mental health, EAP, substance abuse, very dear to my heart and part of my passion. My goal today is to give you kind of an overview of kind of my journey, almost that Oregon Trail out west from Wisconsin to Ohio, Colorado, and finally out west in terms of my appreciation for integrated value-based care and why I'm at Kaiser Permanente. So I'll start with some of my time early in, I would say, early 2000s, late 1990s, where I was doing benefit presentations, and at that particular time, there were limitations on mental health benefits. You would have 15, 20 mental health visits. Then we went through mental health parity. Now we don't have that issue anymore. But I remember doing open enrollment meetings and having people come up to me to say, why are there so limited amount of appointments? And so I'm just really grateful that we've come through that and we've evolved and we have better coverage. One of the things, my background is primarily in the small group insurance space and the large group insurance space. So I'm going to talk a little bit about some of those insights that I gained over time as I moved west. So one of the things that I learned, I'm going to put my water bottle down. One of the things that I learned in multiple presentations and engagements with employer groups is that chronic disease was driving the majority of their costs. Just about every reporting meeting that I would do with an employer group, be it a smaller large group or a large entity, the majority of the costs, 60, 70, sometimes 80% of the costs were driven by chronic disease. And sometimes that was only like 5 to 10% of the population was driving the majority of the costs. So I started to realize over time that it's really all about chronic disease management. I remember doing a presentation similar to this where I was talking about the burden of chronic disease, and I was looking at the CDC website and saying that $800 billion are spent on chronic disease. If you Google today, because I did this morning, that cost, from, let's say, 2003 or so, you do that same presentation today, it's $4.9 trillion are a result of chronic disease. Now that stat, combines the Medicare population and the commercial population. So when you take it down to more of the commercial, the younger folks, there's less chronic disease, but it's still there. And the whole idea about chronic disease management is getting upstream. So I'll leave you with that statistic, and now we'll move towards Colorado. So, and keep in mind, I was with a pure payer at that particular time, and that payer was very sophisticated. They had great claims analysis. They could see the correlation between mental health, depression, and chronic disease, where there's a reciprocal relationship that if you're depressed, you're probably not going to want to take your meds, and you'll have poorer outcomes. And so we could see that, but the issue was that's the insurance company communicating to a patient versus the doctor communicating to the patient. So you only have so much you can do to impact that particular individual. Then in Colorado, I had a really cool opportunity. So this was a 2-day event where a company that I represented invited in decision makers from hospital groups, from broker insurance agents, mental health providers, chiropractors, and we all met to do a business simulation. And there was probably around 40 folks from all these different backgrounds, but all related to healthcare. And the idea was we were going to run a 5-year simulation over 2 days. So it was a two-day event. And the twist was each person took a different role. So the insurance guy puts on the hospital administrator hat, and the hospital administrator hat takes on the insurance, and we all switched roles. And as the simulation went on, you could vote and pull levers on things like invest in your community. So you could invest in parks, bike lanes, bike share programs. Are you going to invest in flu shots? What's the immunization campaign? And I was on a team. We were pulling our levers, and at that particular time, I was like, I don't know if we should spend all that money on flu shots right now. And there was one woman in my group, and she was really passionate about it. I go, okay, let's pull that lever. And then we ran the simulation, and we did okay, but there were other groups that were ahead of us in that first day in terms of profit and sustainability. Then you fast forward to day 2 and the conclusion of the event. And the winning team, which I'm proud to say I was on the winning team, was the one that balanced the costs and balanced the profits between all the groups. So no one really necessarily makes the most profit. It's all about sustainability. So the lesson I learned there was, whoa, it really is all about sustainability, and it's about and then you sustainability and all of us working together. And then I also had this idea around chronic disease management, and I started to get obsessed with really understanding how could you measure performance by health plan? How do you do that? How what vehicle is out there? And I started to study NCQA, the National Quality Assurance Association, and they have something called HEDIS, which is the Health Effectiveness Data Information Set. And what HEDIS does is it looks at performance by healthcare system for different disease states. So diabetes, coronary artery disease, congestive heart failure, and in making sure that they're performing and having great outcomes. And I was looking at that and trying to see who's really the leader. And I'm intentionally trying not to make this a Kaiser Permanente commercial, but the thing that was really exciting was Kaiser Permanente, the Northwest, the Portland market, was a huge standout. And keep in mind, I'm working for a different insurer, and we were having meetings like, how do they do it? And it's really all about that integration and that communication and that collaborative care, and which delivers these superior outcomes. And I was doing a little research prepping for this, and if you research health plans that put an emphasis on HEDIS, you will see they outperform over the long run just about every other health plan. You're going to deliver superior outcomes, which relate to lower costs and healthier populations. So I was. That's why I'm in the Northwest, and that's why I took the tour, the Oregon Trail out to Portland, Oregon. And my reason to highlight Portland and our hyper integration, I have about 1 minute left. When I talk about hyper integration, what I didn't know when I joined Kaiser Permanente Northwest and moved to Portland was that Kaiser Permanente, we have 2 hospitals. We have pharmacy, we have a mail order center, we have a lab, we have medical office buildings. Like, I didn't really fully understand what full integration is, and that and how it enhances collaborative care and excellent outcomes. The reason I bring that up, that's one of the reasons we're here in Eugene. We want to help the community. We want to be part of the community. We want to invest in the community, and we want to help the health of individuals that live in the community. So looking forward to the discussion on the panel. Thank you.
Thank you, panelists. We'll begin our Q&A quite soon, but first a special thank you to our award-winning public radio station, KLCC, for airing City Club programs on Mondays at 7 p.m. In Eugene and Springfield, they broadcast on 89.7 FM. For those listening at home or on your commute right now, your household is one of several thousand tuning into City Club on KLCC. We are truly honored to have you. You can also find all recent City Club programs archived at klcc.org, as well as our YouTube channel and the City Club of Eugene podcast. Our board member Betsy will be moderating a panelist Q&A, so I encourage you to think of some great questions for our guests. Say hi to your neighbor, and we'll be right back.
Okay, can you hear me? Is it coming through? Okay, good afternoon. Answers, please keep your questions short. Ask your question and then go have a seat after you ask it, okay? And just one question per person. This is a big issue. It affects us all. So, yeah, all right. Mary. go ahead.
Mary Layton, City Club member. So this is a question about employee assistance programs. So a million years ago, when my mother, after she raised 8 kids, got a job in life, so she ran an employee assistance program at a hospital. And she said their cost-benefit analysis showed that the money they were spending on employee assistance programs was less money than it would cost to fix the problems it would cost to replace the employee. And I just wonder if anybody still does those calculations, and if so, what do they show?
We do those calculations, and it still remains the same. Yes, when somebody comes to us with an issue that's happened at work, again, we're still dealing with mental health, right? We're still dealing with those soft relationship skills oftentimes. And so, yes, taking care of your employees is then going to help save you on costs of onboarding and hiring. So you're right, absolutely. Thank you.
Joel Corin, City Club member. This is purely a hypothetical question. A while there, when there was discussion of universal health care, there was an issue: should we force everybody into universal health care, or should we allow employer insurance programs to remain? Do you have a position on any of those things?
Whoever wants to answer first.
I understand the logic of both. I don't necessarily have a position. I think one of the key things from my background and when I was talking about chronic disease management, consistency with your, maintaining consistency with your care team and your care provider, most likely will deliver the best possible outcomes. So having that unified approach and being linked to a provider group and not jumping between different provider teams will most likely deliver the best outcomes for a patient if they truly understand your needs and can tailor the approach to meet those needs. Keep in mind, I'm saying this from a non-clinical background.
Despite Betsy's admonition that you don't get more than one question.
Pulling power.
You mentioned that you understand the logic of both positions. Would you explain that, please? What's the logic of having everyone on universal health care? What's the logic of allowing people to maintain their employer health care?
I might understand the logic, but I don't know if I can articulate the cost-benefit analysis enough. I honestly don't think I know enough about the universal side of the house, but I appreciate the question.
Hello, I'm Marty Wilde. I'm a former City Club president, long ago now. I have a question for Robert again. I would say although I speak only for myself, of course, I am a federal employee, and so I appreciate that Kaiser is routinely not only the best care I've received, but also the cheapest from my perspective. How does Kaiser manage that compared to other commercial insurers?
Sure. I would say in all situations, we're not always the lowest cost. There are different dynamics. But I think, as I described kind of my journey west, what I really learned to appreciate is the level of efficiencies that are gained by having an integrated health plan that's aligned to deliver improved outcomes through integration, and that allows you to have more affordability. Also, the kind of that Portland model of that hyper integration. You also have an appreciation for where all your costs are coming from, and you're more or less negotiating with yourself. So you have a better appreciation for the different financial levers that need to be pulled. And so I think that in the long run is what can deliver, a more affordable rate over time. But it doesn't happen in all situations to all employers.
Thomas has been gracious enough to allow me a quick follow-up, and that is, I'm not sure you're allowed to say, but are there plans to expand Kaiser down here? Because I think some of us would like to see more of the Portland model where obviously with primary care here, and mental health care here and dentistry, that's been great, but are we going to see more specialty services in the future?
Yeah, thanks for alluding to, you might not be able to answer this question, but I honestly, I don't have a complete knowledge of the care plan. I am on the Laying Growth Council team, and I've been really passionate about expanding our primary care and adding more providers and partnering with more external providers and eliminating barriers there. So things are going very well, and we're very I guess bullish on on Lane County and Eugene. So we really want to be a community partner. So.
Well, my wife's a pediatrician. I keep telling her to try to convince you to hire pediatrics.
Hello, Thomas Hira, City Club member since 2019. I'm not ashamed of the fact that I was a patient in the behavioral health unit many years ago. It's a part of my history. In that experience, I learned a great deal about how that works and the resources. And I feel like in today's world, there's a lot of talk about this issue of behavioral health care, and maybe a disparity between the amount of people talking about it and the amount of people who have dedicated so much of their lives to being involved in it. And so my question is primarily for Stephanie, but for anybody. What do you think are misconceptions that may exist about the state of behavioral health care in our community?
Thank you. That's a great question. Some myths. I think one of the myths is that you're going to find your person, the first person you meet. That doesn't necessarily always happen. Oftentimes, you'll meet with a counselor and you can decide whether or not that person is for you. Do they see you as a whole person? Do they understand where you're coming from? Sometimes it's the correct fit, and other times it is not. And then it is our job as the behavioral health professional to get you to someone that more aligns with you. I think another one of the myths is that counseling is going to be an inherently painful process. That's not always true. I use a lot of humor in my counseling process, and so oftentimes people are a little surprised that they come in and they think, oh my gosh, this is scary, and I recognize that it's scary to make this leap. Oftentimes they leave saying, I feel so much better. And then I think another myth is that you're always going to feel better when you walk out of the office. That's not necessarily true either. Depending on what you're processing in that period of time, right? There might be more processing to do. And so could be part of your work outside of the counseling space. So.
I think what I've observed in my 6 years in this field is that there is an assumption that most of the people who need behavioral health care or more specifically substance use disorder care are people who live on the streets or who are impoverished, when really that segment of the nation's population, and even in Oregon, is really relatively small compared to all those people with homes and jobs and families. The largest number of people who are in need of care are people who are probably on employer-sponsored insurance. The other reality is that in Oregon, and it's true in the rest of the country, that 90% of the services that are provided for substance use disorder, and I think it's about 60% for all behavioral health, most of those dollars come from government money, Medicaid, Medicare, or block grants. The last factoid I'll share with you is that I know in substance use disorder that of the 100% of people with a diagnosable substance use condition, only 5% seek treatment. 95% don't. And I think there are similar ratios in all of behavioral health. And the reasons that people don't seek it are stigma or access to care or the cost of care or the belief that I've got this and I think I can get myself through it.
I'll add a little bit too, and I don't think this is necessarily a myth, but maybe an adjunct or a complement to access is virtual care, the evolution of a virtual care, and you know, for the mental health space, it can be a preferred path for many people because of the confidentiality, and I think that helps demystify you know, mental health and can help people you know, take care of themselves, actually go ahead and get that appointment. What you just said, Pete, 95% not, you know, pursuing that's you know, if we can make it easier for people to access the care, and so I just want to, you know, highlight that virtual capability, which really, you know, for various organizations, including Kaiser Permanente, became more and more accepted after the pandemic, and during the pandemic, we were able to step that up. So I just want to make sure people are taking advantage of virtual.
Eric, do you have a question?
First, let me start by saying I really appreciate your comment about using humor in counseling sessions. I've used that technique myself with great success in teaching mathematics. So, my name is Eric, and I'm a second-year City Club member. I'm not even sure if this question makes sense, but it just occurred to me. I've been the beneficiary of mental health services, and I was just sort of thinking about it as you were talking about all these things. So, for physical health, insurance companies, doctors, and so forth have found benefit in preventative care. So, vaccines, some health insurance plans provide will reimburse for gym memberships and so forth and so on. What's the role of preventative care as seen from someone who's involved directly, and also is there a benefit to insurance companies?
Yes, funnily enough, I was having this conversation in our kitchen yesterday. We were likening people coming in and utilizing mental health care kind of like massage therapy, in that if you go regularly, right, you begin to feel better. And then once you begin to feel better, things get exponentially better from there. So yes, I think that preventatively, I think we have a fair number of people who continue to see us. Nothing is crisis-like in their life at that point in time, but they want to come and process things and make sure that they're having relationships that are healthy and vibrant. And so, yeah, I think that preventative is a great way to kind of go about that. You want to speak to that as far as insurance?
Sure, I really appreciate the question. One of the things that we've done at Kaiser Permanente is we've embedded behavioral health specialists within primary care. So when that primary care doctor, you know, through some screening sees a behavioral health need, they can quickly tap into that collaborative expertise with that behavioral health specialist. And then, you know, this is kind of my soapbox on chronic disease, but yeah, it's incredibly important that we balance, you know, that physical health with the mental health. Like in all the literature you'll see on chronic disease, if there are mental health challenges with that patient, you're going to have poorer outcomes. So it's really important to make sure that there's a balance of mental health care and physical health care occurring to deliver the best results. And we absolutely understand that, and we have embedded that approach Additionally, I think the culturally competent side of the care is really important too. Understanding different cultures have different perceptions of different diseases and disease states, and so meeting them where they are and having that behavioral health coach to help that primary care team really engage with that member will ensure better outcomes.
Good afternoon. My name is Mark Horney. I'm a City Club member. I'd like to get back to this question about affordability. Those people who don't have insurance and don't have the economic means to pay for them. And I presume these people might be getting the insurer of last resort is Medicaid, I would presume. But Medicaid seems to be increasingly difficult. I mean, it seems like Medicaid may disappear within not too long. What would happen if that whole segment of the population doesn't have access at all because of that?
Yeah. Do you have an answer? Okay. Well, that's a good question because we really don't know what the future of Medicaid will be in the next few years. In Oregon, we're pretty fortunate that just about every Oregonian has health insurance coverage. Nearly 30% of Oregonians, and Lane County has the highest percentage of its population that are enrolled in Medicaid, and the rest are on employer Medicare or employer-sponsored health care plans. So in Oregon, we're actually in a pretty good place. The problem here is access to care, and the state has invested significantly in the last few years. We still have the lowest access to behavioral health care, particularly substance use disorder, than any other state in the nation. So we have a lot of work to do. Without that, I mean, it'd be frightening to think of what the conditions of so many impoverished people would be if they didn't have a place to go when they were suffering. And we're talking about conditions that are life-threatening. And so I hope that isn't our future, but it is definitely something we as Americans need to be considering.
I'm also going to provide a resource for those people who perhaps don't have insurance or are fearing that they're going to lose insurance. As far as accessing behavioral health, Psychology Today runs a website in which you can screen for a mental health provider. It says, find a therapist at the top of the website, and many behavioral health people are advertising on there. They will talk about what they do, and many of them have a sliding scale, and so that's how this piece fits into the question. If somebody has a lower socioeconomic, that you can still find people who are available and trained well.
I don't have anything really additional to say about it, but if Medicaid went away, it would put tremendous cost pressures on the rest of the system. So, the balance of, the balloon analogy, you need a balance to keep things, somewhat affordable, and so that's it would put tremendous cost pressures for providers, for insurers. So thanks for the answers.
I'm Marilyn Milne, a longtime City Club member. I would also mention Center for Community Counseling, which does a sliding scale service. My question is for Pete. I had the privilege of working with Serenity Lane for many years, and so I'd like you to talk about something I had to learn, which is about the co-occurring kind of disorder, that there's a definite mental health factor in recovery. And the other thing is, what gives any of you hope for behavioral health improvements? You know, where do you see progress? I thought of Lane County and Peace Health teaming on a behavioral health unit, but now the neighbors are protesting that. So what gives you hope for how we move forward as a society?
Yeah, and I'll briefly answer, provide an answer to the first part of your question, and then Stephanie will need to take it from there. Because I'm not a behavioral health professional, but there is no question that there is a relationship between mental health conditions and a person's substance use disorder, and one leads to the other, perhaps. There's also a very consistent pattern of substance use disorder occurring in families, so there might be a biological factor there, or an experience that people have growing up in a household where parents suffer from alcoholism. And there's also a very close tie between adverse childhood experiences and substance use disorder, people who are dealing with trauma that they hadn't found other avenues or other ways of handling that. But I'm sure Stephanie will have a much better response. And Serenity Lane has identified that many years ago, which is why we have such a full staff of psychologists and mental health therapists in addition to our other counselors. So we treat everybody we examine everybody for a mental health condition that we can treat alongside the substance use disorder. The hope for the future for me is that so much is being learned about behavioral health today. And we know, for many years it was thought to be a character flaw that someone had a substance use disorder, or that someone couldn't deal with their depression or their anxiety. Just a little more willpower and a little more dedication, they could probably get through it. The reality is, at least with substance use disorder, there's been a rewiring in the brain, a transformation of the brain, transformation that's never going to go away, but which can be overcome with good coping mechanisms and other training. And the brain will heal, won't completely heal. It'll always be susceptible to that. And some programs like Serenity Lane doesn't do this, although I look forward to a future when we do, where they're imaging the brain as a person goes through treatment so that the patient can actually witness the healing that's occurring as they're starting to feel better. And there are other, treatment solutions down the road. GLP-1 is the weight loss drug that's become popular in the last year. There's some value in that for treating substance use disorder. And I just think that the advances that we're going to see are going to be terrific here in the future. Also in Oregon, where there's been such an intense focus on improving capacity, there's partnerships between places like Serenity Lane and LCC, which is training counselors, and Bushnell University, which is training people in mental health and psychology. University of Oregon, the schools up near our clinic up in Portland, where we're partnering with them to provide training opportunities. We're a training institution for medical students, psychiatry residents, nursing students, mental health interns, and that partnership and we have our own counselor and training program. That partnership is enabling all of us to build the workforce that's going to be needed here into the future to provide for a growing mental health care need.
I think you addressed that beautifully. As far as the hope for the future, I echo everything that Pete said, and then I have the honor of sitting with people every single day of the week. And I get to watch growth happen before my eyes. It is an amazing privilege. And so the hope that I see is just in my daily work, with people being able to make decisions that they understand at some point are healthier decisions for them. And so I believe just in the daily work is where I find my hope.
Okay, we have 2 minutes left, so just wanted to let you know.
I definitely have a lot of hope and optimism. I'm always someone that has been championing innovation and change, and this just coming together today as care delivery partners and the community, I think it's all about increased communication. And as these systems, these business systems and these clinical systems evolve, that's going to help us deliver better and better outcomes and resources and access for people. So I'm really excited about where things are going. It's difficult, complex work, and it requires people that are leaning in and invested. And so I just wanted to share that.
Thank you.
Add
I think we have like
one more.
Okay, go ahead.
Very quickly, talking about partnerships, Cascade partners with Serenity Lane. So again, with that EAP program, if you had somebody who was at work who was intoxicated in some manner, you could call us and we can come out and help you and then get that person in through our EAP. And we have a person that we work with at Serenity Lane whose name is Mason. And so we have kind of a direct line to Pete, which is lovely.
Okay, Paul gets to squeak in. Thomas is letting him. Go for it,
Hi, I'm
Paul.
Paul Thompson. I've been a City Club member for a long time, decades. Let's see. I'm interested in the state-of-the-art of the treatment. We have had lots of information about how to pay for the conventional behavioral health treatment. But what's the state-of-the-art and what improvements in the state-of-the-art of the actual behavioral health treatment going on that we should be watching?
That could be a whole nother program.
I think the thing to be watching is research. We practice empirically based counseling, and so we want to make sure that our research is really good and really grounded. So I believe that's the thing to watch.
In medicine, outcomes are tracked very closely. They're so empirical. When a child breaks a leg, we know when that leg is healed, and we know exactly what treatment was provided. Behavioral health, for many years, less so today, has been more of an art than like a medical practice. If I need to have my appendix removed, there aren't 25 ways for that surgeon to remove my appendix. There's maybe 1 or 2 ways, depending on what they're facing. But in behavioral health, it may depend on who the practitioner happens to be, on how that condition is going to be treated. What we're seeing in behavioral health today is tracking of the outcomes. And Serenity Lane, for instance, belongs to a national association that is tracking treatment outcomes at every stage of treatment and post-treatment. And for the first time really in the history of this kind of care, we're beginning to understand exactly the effects of everything that we do, and so that we can modify our treatment protocols, the objective being to achieve the best treatment outcomes and healthy recovery for the people that we care for.
Thank you. That's all the time we have for questions. I'm going to turn it over to Thomas, and thank you so much, the 3 of you.
Thank you for joining us one more time for Pete Kern, Stephanie Evans-Wondra, and Rob Sheely. This has been our November 7th, 2025 conversation at the City Club of Eugene. We'll be back here next week at Wow Hall on Friday, November 14th at noon. That program is called The Eugene Airport, What is the Price of Sanctuary? It is sure to be a great forum, and we're looking forward to seeing you there. Thank you all. Have a great weekend. We'll see you next week.